What about implementation of the findings? Could this be done on a wider scale? And would it help with the estimated 4 million people who are said to have incorrect penicillin allergy labels?
It can help with implementation, absolutely. And that is my area of research. So that's what I'm doing in my fellowship, is looking at how we implement penicillin allergy delabeling as a standard of care for hospitalized patients. And they're already doing that in Australia, where it's now become a standard of care. But, hospitals are expected to risk assess penicillin allergies and delabel it as an expectation, whereas it's currently an ambition of ours in the UK. So to implement it, we have to understand what the barriers to implementation are. How do we introduce this tool, whether it be PenFast or another decision support tool? How do we introduce that into the NHS, which is already a busy, at capacity healthcare system? So yes, we can implement it. How we implement it is the next question. And my fellowship looks at what the potential barriers to implementation of a penicillin allergy delabeling tool might be, and what the enablers are, what the attractive bits are, and then trying to work out how we remove barriers and bring in the enablers. And we're doing that as part of my fellowship, but also with other hospitals around England. So we've got Imperial and King's and Papworth and Bristol. We're doing it together as part of another study that Australia are coordinating called the iNAAN study, and looking at how we implement this as a standard of care, learning from the Australians and the global literature, but also learning from each other within the UK about what our barriers are, and also learning from the findings of my fellowship. I've done a lot of interviews with patients that have been delabeled via this method in our own hospital, and also interviewing healthcare workers about penicillin allergy delabeling to find out what their concerns and what the barriers are to sort of changing behaviour around that.
That's interesting. You mentioned the iNAAN project. Can you tell us what this is about?
It's called the iNAAN study, so the International Nations of Antibiotic Allergy Network. 39 hospitals in Australia have signed up to it. 5 in the UK, of which the Royal Cornwall Hospital is the sort of the hub, if you like, the sponsor, and then we're working with the other sites. 1 in Canada, 1 in South Africa in Cape Town, 1 in United Arab Emirates. So these hospitals, so there's 40 plus, I think, of us, will implement penicillin allergy delabeling in our hospital as best we can through whatever method we choose to use. And we'll have our own local signed off guidelines that go through our medicines practice committee or governance structures. And they'll be delivered differently in each hospital. It might be pharmacists doing it, it might be nurses doing it, it might be one enthusiast doing it. However it's done is up to the hospital with its own guidelines. And the study is a data collection study where patients who are identified with a penicillin allergy record are risk assessed, and from then that point on, their data is collected. If they're low risk and delabeled, data collected. If they're high risk and not delabeled, there's key data collected. And what the study, and all that data then gets sent to Melbourne and they do some stats on it. But what they're looking at is they want to compare patients with a penicillin allergy record to those without a penicillin allergy record, try and case match patients as best they can, and then look to see whether if you undo the label, does that change prescribing? Does it change the types of antibiotics used? Well, we know it does, but let's look at it. But more importantly, does it change patient outcomes? Does it change mortality? Does it change length of stay? Penicillin allergy records are associated with increased mortality, increased length of stay. If you undo the label, does it bring about the change? We don't know. To design a randomized controlled study to look at that, you'd involve huge numbers of patients. So this is the next best thing, of trying to collect loads of data on patients that have been delabeled and those that haven't from an international sort of cohort, and then do the stats, if you like, to see whether undoing the label undoes the harms. So that's what that study's about. And it's going to be, I think it's going to be sort of data collection over 10 years, I think. So they'll have loads of data to then try and, with the primary aim to see whether undoing the label undoes the harm.
Very interesting. Now, I've also read about the Alabama project, and I believe you were involved in that. How does this fit in, and what does it involve?
So the Alabama study has finished recruiting now, and so hopefully we'll see the results of that soon. So the Alabama study is based in Leeds. That's where the sponsor site is, and there are sites around the country of which we are one of the study sites at the Royal Cornwall Hospital. What the study looks to do is ultimately, the main aim is to identify patients from GP records who have got a penicillin allergy record, identify which of those are low risk, randomize them to allergy testing or not allergy testing, and then to follow patients up to see whether those that have been delabeled have different health outcomes to those that haven't been delabeled. So it's another study looking at whether you undo the label, does it change the antibiotics used in a randomized controlled study, and what impact does that have on health outcomes, mortality, side effects, healthcare associated infections, treatment failure, that sort of thing. Also, with the Alabama study, there's a big behavioral component to that, where they've looked at patient perspectives and GP perspectives around penicillin allergy records and penicillin allergy testing, and sort of worked out or investigated what the potential barriers might be for GPs referring patients for allergy testing, and also what patients understand and what healthcare workers understand about what a negative penicillin allergy test means, and whether they believe that test and whether or not they would continue to avoid penicillin in the future, even if they have a negative penicillin allergy test. So as part of that, they've come up with a behavioral package which helps remove some of the barriers to GPs referring out to patients, and also ensure that patients and GPs have a good understanding of what allergy testing involves and what a negative test means for them, so that to optimize this intervention. So to ensure that once you've delabeled a patient, the patient and the GP believe the test and they change their behavior going forward, i.e. they prescribe penicillin or they consume penicillin in the future, and to not continue avoiding it. Otherwise, the intervention of delabeling is lost if people then continue to avoid penicillin.